Assalamu alaikum dear students. In this video tutorial we will discuss KMU-CAT 2025 test preparation part 1f. Dear students, अगर आपने अभी तक KMU-CAT टेस्ट के लिए रजिस्ट्रेशन नहीं की है तो अभी रजिस्ट्रेशन कर लें और अपना सीट कंफर्म कर लें। अगर आप KMU-CAT टेस्ट के लिए तैयारी कर रहे हैं तो ये वीडियो आपके लिए है। इस वीडियो को आखिर तक ज़रूर देखें। The larynx and the trachea are at dash region of the neck. Option A medial, B posterior, C anterior, and option D central. So the correct option is C anterior. The larynx and trachea are anterior neck structures. So this is very important MCQs. The meningeal layer provides tubular sheath for the option A spinal nerve, B cranial nerve, C periosteal nerve, and option D periosteal arteries. So the correct option is B cranial nerve. Explanation is the meninges form sheaths around cranial nerve. Subscribe now and press the bell icon. Never miss an update from early technologist. On the medial surface of the body of the mandible in the median plane are seen the option A foramen magnum, B mental foramen, C mandible foramen, and option D mental spines. So the correct option is D mental spine. The mental spines are midline on the inner mandible. So this is very important MCQs. Subscapular fossa is located on the dash surface of the scapula. Option A posterior, B anterior, C medial, and option D lateral. So the correct option is B anterior. The subscapular fossa is on the anterior costal surface. A tubular structure that joins the pharynx to the stomach is option A crania, B cricoid cartilage, C esophagus, and option D trachea. So the correct option is C esophagus. The esophagus traverses the diaphragm at T10 to connect the pharynx to the stomach. Deep fascia is well defined as option A neck and limb, B head, option C limb, and option D eyelids. So the correct option is A neck and limb. Deep fascia is thick in the neck and limbs, providing structural support. The thoracic cage is made up of all except option A clavicle, B costal cartilage, C ribs, and option D sternum. So the correct option is A clavicle. The thoracic cage comprises ribs, sternum, thoracic vertebrae, and costal cartilage. The clavicle is part of the pectoral girdle. A muscular tube that extends from the kidney to the posterior surface of the bladder is option A epididymis, B seminal vesicles, C ureter, and option D urinary bladder. So the correct option is C ureter. The ureter transport urine from the renal pelvis to the bladder, running retroperitoneally. The most abundant form of cartilage having pericardium membrane associated with synovial joint is option A. Costal cartilage, B. Elastic cartilage, C. Fibrocartilage, and option D. Hyaline cartilage. So the correct option is D. Hyaline cartilage. Hyaline cartilage cover articular surfaces, form costal cartilages, and has a pericardium. So this is very important MCQs. Carpals and tarsals are examples of option A. Flat bone, B. Irregular bone, C. Long bones, and option D. Short bones. So the correct option is D. Short bones. Short bone, for example, carpals and tarsals, are cuboidal and primarily spongy bones with a thin cortical layer. The largest sesamoid bone of the body is option A. Clavicle, B. Fibula, C. Femur, and option D. Patella. So the correct option is D. Patella. The patella is the largest sesamoid bone embedded in the quadriceps tendon. The outpouching of the testes is option A. Ductus deferens, B. Omenta, C. Testes, and option D. Scrotum. So the correct option is D. Scrotum. The scrotum is a cutaneous pouch housing the testes, regulating temperature for spermatogenesis. Subscribe now and press the bell icon. Never miss an update from a technologist. Ribs, scapula, and skull are examples of option A. Flat bone, B. Irregular bone, C. Long bone, and option D. Short bones. So the correct option is A. Flat bones. The flat bones, for example, skull, ribs, scapula, consist of two cortical plates with spongy bone in between. An immovable joint that holds most skull bones together is option A. Ball and socket joint, B. Ellipsoid joint, C. Hinge joint, and option D. Suture. So the correct option is D. Suture. Sutures are fibrous joints between skull bones, permitting growth in youth and fusing in adulthood. Thank you for watching my videos.